Hello again. This is Dr. Paul Bacon from Advanced Spine Health and Wellness in Portsmouth, New Hampshire. I wanted to talk a little bit more about degenerative arthritis. And as you recall, I continue to express myself as the posture doc because I believe that I am one of the foremost experts in the achievement and maintenance of ideal posture in our society today. I have been studying spinal biomechanics, abnormal form and function for nearly 40 years now. Now, recall last time when we spoke about degenerative arthritis, we spoke about the movement of calcium in bone. And for those medical providers out there who may be listening to this, both chiropractic as well as orthopedists and etc., we all know about bone physiology and the migration of calcium in bone. For people who are not experts in the field, for people, the general public, we need to understand that calcium is dynamic. It is not a static entity in bone. So the movement of calcium in bone is controlled by many factors in the human body. One of the avenues that I utilize to reestablish ideal bone physiology is controlling the loads on bone. Recall that we said that calcium migrates to make the bone denser. It migrates to the load and tries to increase the density of bone to make the bone stronger to endure or to accommodate and adapt to the load that's upon it. So if we have a situation like this, in which we have a lot of load on the bone, the calcium would be predictably go to a particular area on the bone. And that is incidentally radiographically evident. We can see this all the time on x-rays. And if we would do a vector analysis, and by a vector analysis I'll use a pointer, and when we look at the spine from the side view, we would see that these vectors represent the ideal curve in the side view of the spine facing to the left. If we take that spine and spin around from the back, the vector line should line up to gravity so that all weight distribution is equally distributed relative to a center, axial center as it says in the textbooks. So when we have this situation and do the vector analysis, we would see that the concave side is where the load is greatest, and that's where the calcium would migrate to in that situation. So we would see that the calcium spur formations build up on the edges of bone here. As I also said, remember that the bone will remodel. The bone will change its shape to suit its new environment as long as it's remaining in that environment. The key factor are those very words, as long as it remains in that environment. So that if we were to utilize muscular contraction by very, very particular exercises and pull, remember that muscles attach at distances, so that we would contract the muscles on this side, that would pull this vector in line with this vector and resolve that displacement and then reorganize the weight distribution on bone. Bone is migrating in bone, calcium is migrating in bone all during life. And so then there's never not a time when calcium is not moving in bone. So a lot of folks in our society think that calcium spur formation and these degenerative changes are non-reversible. Well, I think we need to take that with a grain of salt. If we could control the load on bone, we would be able to influence the location of calcium buildup on the bone very, very greatly. We can prove this on x-rays by going in and do exercise protocols that replenish the fluid in the joints, pumping exercises to rehydrate the joints and discs, and also controlled exercises under gravity to make this spine come back into gravity. And if you were, for example, like this in your posture, and we put a weight on your head over here, your brain's writing reflexes are controlled by the visual mechanism, would recognize that it's not in line with gravity, would tell the muscles on this side to contract and pull you up to gravity, therefore unwinding these angles and putting them back into gravity. Now you would take the compression load on this side where the calcium is migrating to, and with the contractile tension of the muscles on this side here, remember the spine is three-dimensional, so that those vector lines from the side view like this and from the back view like this, or in fact as I'll do it like this here in my own neck. So if my configuration is like this and I contract the muscles on the right, I would necessarily have to move around an arc of motion to get to the midline situation. Now that wouldn't be done casually or randomly, it has to be done very, very specifically. So you would need accurate x-rays to do a vector analysis on this spine and reorganize this tissue and be able to take serial x-rays down the line to see that these changes have taken place. The reason why chiropractic manipulation would be very useful in this situation is that as long as that spine can function globally with all the vertebra functional units working, then this spine would move around that arc of motion and get to ideal. However, if the vertebrae are very fixed, physiologically locked, then you would have to make those joints more pliant and movable in order for this whole region, neck or cervical spine, to respond appropriately and come back to midline. So that these are, in essence, not theoretical, because we've proven it by serial x-rays repeatedly, actually thousands and thousands of patients over the last 30 or 40 years that I've been involved in it, so we can do this very readily. It's not as easy as pie, but it certainly can be done with skilled hands and a knowledgeable practitioner. So we want to get this notion about degenerative arthritis that it is not a static entity. It can change over time with controlled rehabilitation. Keywords. Thank you again for listening. Dr. Paul Bacon, Advanced Spine Health and Wellness, the Posture Doc, Portsmouth, New Hampshire.